Now we have 3 experts in probiotics with many years of study in this area with rich experience. And now is your last chance to have a face-to-face discussion and pose questions to them. The moderator just said that we're going to have a panel discussion about probiotics, opportunities, challenges, and the applications, as well as its relation with the diseases in China's market. And Madam Dr. Jin just talked about its role in preventing diseases. I do believe that probiotics can have impact on people at different stages, different ages. So any question from the floor? Well, question for 3 experts. For the whole afternoon, we're talking about, we're listening to the application of probiotics. I'm in the sweets and chocolate industry, so I have a question for our foreign friends, because of lots of they are more advanced than us, and it's still about the regulation. This is a very practical issue. Even if you can have very good R&D, you cannot commercialize it if it does not comply to the regulations. So my question is that, is there any law and the regulations that you can recommend? Because right now in China, there is basically no such kind of laws and regulations in this area. Or maybe what I can say is that, well, probiotics in China are sold mainly in yogurt or probiotics drinks, or it is sold in dietary supplements. Probiotics or fermentation are very buzzy words right now. People now are very willing to use those words on conferences, and business are also very acceptable to those words. I'm from DuPont, and we have lots of application labs that did dark chocolate, opium sweets. And because I'm a professional doctor, medical doctor, so we tested 24 months or 36 months of studies on those things. What I would say is that chocolate is not a very ideal carrier for probiotics, because first, chocolate is stored at room temperature, and secondly, chocolate is relatively active, so it will affect probiotics. Well, bacteria can be very different. Some are stable. There are lots of other bacteria that are not so active. People talk about all kinds of technologies to stabilize those bacteria. Well, I think that you can use this media in those carriers that are not very stable. However, you have to be careful of those technologies. You use those technologies, and then people will talk about, what about releasing of probiotics? So this is a question you have to overcome. The other thing about the regulation is that I agree with you, and what I want to share with you is that several years ago, in milk powder industry, when people try to added probiotics into milk powder, and then, according to the Chinese regulation, the bacteria level or standards set by the government are not applicable. And so that means the government regulation need to change. The other thing is about the testing methods. I personally think that the government are using good testing methods. They required certain cultures, etc. Probiiotic is the most the simplest method that you can use to test. But for yogurt or bifidobacteria, and there are lots of differences in those testing methods. But in the interest of time, I cannot elaborate on this. But if you're interested, we can talk offline about this. Thank you very much. Very comprehensive answer. Dr. Zink? Dr. Zink, when he worked for Nestle, he was in charge of this, so please.
Actually, the question you're asking is a very good one, because it has a twofold answer. We as companies, and I'm representing here the 12th biggest dairy company in the world, we as companies, we are responsible for the products we bring in the market. So authorities ask us two questions. The first is the product safe? And there is no maybe. There's only a yes or a no, and if there's a no, it will be not on the market. The second question, which the producer is responsible, is the product delivering what you expect? So is the claiming you're saying right, or is the customer cheated? And this is the obligation of the companies who bring the product in the market. Now, to your point, if probiotics could go into sweets and chocolate, I would like to add on the answer my pre-speaker said. Yes, it can be, but it's difficult. For example, you could encapsulate them, you could use technological tools to do that, but the product would be more expensive. It all depends on the claim and on the benefit and what the consumer wants and what he's willing to pay. But there should be not a maybe, it gives the function. No, there should be yes, it gives the function. And this has to be proven scientifically with clinical studies. And the consumer needs to accept that certain products have a certain price if he or she would like to have a certain functionality.
Great, thank you.
Maybe I will just like to add on these 2 points. First, I remember that many years ago I did this kind of study on chocolate with a big company in Biostime in Europe. And it was working. Actually, we had reasonably good stability, but as my predecessor was saying, you need to microencapsulate the bacteria. That was the first point. But the second point you have to really question yourself is the market need and the market acceptability for this. Because actually we launched this product with Biostime, but it was not a good result. The reason is that when you eat chocolate, then you eat chocolate. You want something which is pleasure, and you don't associate necessarily this product with health. Okay? This is the same thing, for instance, for ice cream. There have been a lot of things done on ice cream with low-fat ice cream, with diet ice cream. Nobody cares about it because you want a good ice cream with good taste, with a lot of fat inside and a lot of sugar. This is what you like. So to put probiotics in this kind of product is maybe not the best way. I think, to me, what I've seen on the market in the last years that I've been in probiotics is that for the food, definitely the dairy products are the best one, on the yogurt, on the dairy milk, and so on. Even I think the cheese is a failure because when you eat cheese, well, you don't eat too much cheese in China, but when you eat cheese, there's a lot of fat inside, and that is not really what you like. It's not really associated with health. But the second point, which is important, and that we have seen again very much last time I was in Anaheim in California, and then Natural Product Expo West, there is a lot of new fruit juices. And fruit, of course, is very healthy. Fruit is giving a lot of benefits because a lot of vitamins, a lot of healthy claims. So you can consider to have fruit juices and you can consider to have a dairy product. But again, the same as the predecessor was saying, you need to have a very strong lobbying with the Ministry of Health because all the GB standards that we have today, they are not applicable, they are not enough, and they are limiting the innovation in China. And this is a big problem, I think. This is a big problem because you know your organization of the regulation in China is very complicated for food to be innovative. So this is something that you should, as the associations, work with your authorities.
But the question I would like to ask ourselves is, are we not limiting ourselves too much? If we limit probiotics to health, what if we extend the term probiotics to improved functionality, to improved bioavailability of nutrients, to improved stability of nutrients? If the bacteria take it up and you take up the bacteria, it's like a protective coverage. I personally believe that the term probiotic, always limited exclusively to health, is too restrictive. Because then you are fully right what you say, but I can imagine easily that probiotics could be linked to improved functionality in bioavailability of nutrients, in stability of nutrients. All these things give then, for products with a very long shelf life, for example powders, infant formulas, a completely additional functionality, not just a strict health, but nutritional or maybe wellness, or as we heard from Nielsen the day before yesterday, convenience. And if convenience is that a product is stable, try it, and you add a probiotic with maybe rich in vitamins, for example, or minerals, or even what we heard 2 presentations before, improved safety because it binds maybe heavy metals. I think the term probiotic should come to a probiotic 2.0 version.
If I can add on what has been said, I fully agree with this. And if you look at, for instance, the yogurt, we know that in yogurt the lactose content is still very high. So a little bit of lactose has been consumed by the lactic acid bacteria, but a lot of lactose is still present. But if you consume yogurt, even for people who are lactose intolerant, there are better absorption of lactose, okay, because of the texture, because of the yogurt itself. So whatever you have lactose inside, then you are not suffering for lactose intolerance if you eat yogurt, while you will suffer if you drink milk. So I think that this is a good example where probiotics can have, by the texture or by the other properties, better acceptability for the nutrition.
Should I speak English or Chinese? I don't know. I would like. Okay.
Well, there's one thing I want to say. You're saying chocolate might not be a good choice, and we should have a wider definition of probiotics. Well, ambient yogurt is very successful. I think this is a very good example. Just like you mentioned, for ambient yogurt, they do not have active agents, but they are very successful. Why? They don't have bacteria inside, but they have a lot of other functions. For example, it can help absorption of vitamins. And after fermentation, the proteins become smaller, and there are a lot of vitamin B's and enzymes, easier for people to absorb, and other flavors as well. So probiotics, lactobacteria, have some health benefits. May not have health benefits, but can help absorption of nutrients or acid, lactic acid. So it's not only about health. So that's a very good question. It has raised a heated discussion from different speakers. Kids love to try a variety of products. If probiotics is that good, and then we should provide diversity of food, diversity of probiotics to different foods to the kids. Good afternoon, speakers. I'm from Baolin Baoyue Biotech Company, and we work with Biostime. We work with prebiotics. You are talking about probiotics and their benefits to kids, to infants, and to toddlers, and to senior people. So my question is, Dr. Jin, Have you ever done any comparison between probiotics and prebiotics? Because I heard there's a probiotic powder which also include prebiotics. And the total sales of the product is about 1 billion in China. And Biostime has done a very good job in its formula because it has a very good position in the market in terms of probiotics. I'm thinking if we combine probiotics and prebiotics, maybe the results will be better. That's a very good question.
Very good question, but I think we should differentiate here a little bit more. Prebiotics are carbohydrates which are in fact like a lunchbox for the bacteria you already have in your gut. Example is the bifidobacteria. They need basically additional carbohydrates to be active. Now this is only one part of the story. There are certain functions where prebiotics can, where functionality of pro and prebiotics, so carbohydrates and bacteria might be the same. But bacteria can do much, much more because they have completely wide variety of functionalities. If you, in a smart way, combine for a certain health claim, the strain who does something and maybe a carbohydrate which helps the strain to survive, I call this lunchbox, or which gives an additional function on top, you can tailor-made something which might go in the category of personalized nutrition for you or for me. Long-term thinking. But just to replace pro from prebiotics is an idea many people in marketing had in the past because prebiotics are cheaper. It's a carbohydrate, a FOS, something which is functional. And for probiotics, you need microbiologists, fermenters, and stability. I think it depends fully on the claim and on the functionality you're expecting. If your question goes in the direction, can I have the same functionality with a prebiotic? I would say, yes, do so, because you have no problem with shelf life and overdosing, you can control this better. But if you have a functionality which is strictly limited to an active metabolism of a bacteria, a prebiotic will not deliver that. So it could well be that in a smart combination of both, and this needs to be smart, not trial and error, you find the right solution for your product, for your market, for your target group, and maybe for your country.
Yeah, I can maybe just add one point. For those of you who were listening in my talk this morning, I was talking about the HMO, because in that case we are something which is very special and very specific for bifidobacteria, especially for bifidobacteria, and which is essential for the growth of these bifidobacteria. So it's a lunchbox, but it's more than that, because it has an actions to prevent infection as well. So that means that it has basically two main functions. But it's not. But if we look at the probiotics, for sure, they have other functions. They can produce vitamins. They can produce bacteriocins, so they can inhibit also different bacteria that you have in the gut. So that means that the function of probiotics are bigger. So what we use today as using GOS or FOS, when I designed this product for Biostime 15 years ago, there was not that many prebiotics that were available on the market. Only FOS was available. GOS even didn't exist at that time. So we are limited to use this kind of product, okay? But now I think in the future there will be more opportunities to develop prebiotics that will fit more with your functions and with your bacteria. And I think that the research which is doing now is really more in this direction. Coming back to the bacteria and probiotics, I think that what we know also today from the analysis of our gut flora, and for certain conditions like people who have suffering for IBS, for instance, for irritable bowel syndrome, so these kind of things, we know that they are lacking some bacteria, and they are lacking some specific bacteria. And because we understand very much now what is the metabolisms, what is the way that the bacteria of your gut are producing, for instance, short-chain fatty acid, and if they are not producing this short-chain fatty acid, there is a lack. of something, or they cannot absorb the hydrogen. So you have a lot of possibility to have combination of hydrogen with sulfur, giving H2S, which is very nociceptive and give rise to pain. So we know much more about the metabolism of the gut. So that means that tomorrow, I think, the probiotics will be more targeted. So it can be, we will have to separate probably what is the probiotics used for drug, for treatment of IBS, IBD, inflammatory bowel disease, on these kind of things, and the one that will be designed for the food. And as my predecessor was saying, for the food, maybe we have to look at more other functions than just the health. That's for sure.
那个接着刚才两位专家先回答。
To answer your question first, I think the answer is yes. Probiotics and prebiotic is called symbiotic. I think Biostime, the Chinese name is very good. So apart from what they said, I want to add a few words. Currently, we only study probiotics. I'm not saying prebiotics are useless. It is simply because I need to avoid all the interactive, all the other factors. And there are a lot of studies studying the combination of prebiotics and probiotics. And which prebiotic is suitable for which probiotic. And we must look at the activity of certain enzyme. If the activity of a certain enzyme is very high, then maybe this prebiotic is suitable for this probiotic. You can see that from the genetic side. So I think in the future, probiotic will not stand alone. We will add prebiotics as well. So prebiotics and probiotics need to be further studied. This is what we are going to do in the future. Any more questions? So I have a question. So I will speak Chinese. So today we talk a lot about functional ingredients and components that are used in food products, oligosaccharide and proteins as well. And my question is, apart from prebiotics and probiotics and oligosaccharide, the topic of this forum is oligopeptide. So my question is, for functional ingredient oligopeptide and its application in foods, do you have any comments on oligopeptide? 寡肽 Oligopeptide.
I'm sorry, I'm not too familiar with the research on the oligopeptide. I don't know if you talk of peptide of 3 or 4 amino acids, and that may have some functions. For sure, they may have some function like immune functions. They can definitely have let's say not only nutritional function but also more functional. Sorry, I was looking at my word. But to be honest, I didn't see any very strong research at this moment on this topic, beside the fact that to use, of course, hydrolyzed protein for improving digestibility and these kind of things.
I think this question may not be very good for this group to answer. So maybe next question. So let me try to answer your question. Functional oligopeptide. Which oligopeptide are you talking about? That was a very popular additive in food. And according to the different size of ammonia acid, it has different functions. Basically, oligopeptide is a nutrition. It can provide more ammonia acids working like protein. It also has other functions, for example, antioxidants and and better absorption of heavy ion and removal of lead, etc. Thank you very much. After hearing the discussion, you were talking about abuse, about antibiotics in China. So I came up with this question. Chinese people are using a lot of antibiotics. So my question is, after using antibiotics, how can you rebuild your microflora health in your gut?
From my side, one has to remember that probiotics, at least in Europe, were used for a long time in animal nutrition as a replacement for antibiotic treatment. That means if probiotics are capable of killing or inactivating undesirable bacteria, they have a function. They have a similar function in this context as antibiotics. Now, if you are a patient and you have, or if you are an elderly, or if you're a person who has not developed the GI tract, so the microflora in your stomach and in your GI tract completely, as we saw this morning, you have a certain risk that bacteria you don't want to have are basically entering your body and staying in your body. So probiotics are very often in a powdered form or in a food form, at least in Europe, are given for those people who have problems with their GI tract, even or either if they are having a treatment after cancer treatment, for example, or after having strong diarrhea, or after having general GI tract problems. So if your question is if probiotics can help to restabilize a structure and a good microflora, yes. If the question is if they can act preventively against bacteria you would otherwise have to kill with antibiotics, I would say yes as well. So there are opportunities, but not all strains, and it's always a strain by strain decision. This is important in this context. I'm a molecular microbiologist, and I don't believe that all bacteria are good, as not all bacteria are bad. You have to show this in a proof, strain by strain, for application. This makes it complex, expensive, and just not an easy answer.
So if my understanding is correct, basically you cannot recover your balance after the antibiotics treatment.
No, well, actually you can, but it takes time. Like all the studies show today that after an antibiotic treatment, you need at least 1 month or maybe 1.5 months to recover the same microbiota profile that you had before. There are a lot of studies that have been done now on this. So we know that antibiotic treatment will destroy your gut flora, will modify it, and it will take time to recover, like many weeks. Okay. And if we look at specifically for China, and if I look at the situation for pregnant women and babies, due to the fact that what I was saying this morning, we have a lot of high pressure on the C-section in China. So that means that there are two things. First of all, the mother receives an antibiotic treatment because of the C-sections, okay, systematically. So the baby receives it as well. of course. So, so that means that we have a big pressure on antibiotics at this moment in China. And that means that on the second point is that because you are in C-sections, you are not contaminated naturally by the vaginal flora of your mother. You are contaminated by the bacteria that are in the environment of the hospital, which is not exactly the same thing. So, so that means the baby will take a lot of time to develop a functional gut flora. If also is not breastfed, so it doesn't get the HMO that I was talking about this morning, and also maybe the bacteria, the probiotics that are already in the human breast milk, then it will delay even more the situation. So that means that we have to very be careful in antibiotic treatment. We have to be careful on encouraged breastfeeding, that for sure, and we have to be careful with C-sections. That's a very strong message.
谢谢你。
我再补充一点点，就是刚才回答您的问题肯定是的，但是我
Well, the answer is yes. I'm sure that you're also interested in how it recovered. As the other two said that it will take you about 1 month to recover without any intervention. I remember there is a study that described in very details about the situation. It said that your gut situation of flora is like a lawn before you take the antibiotics. But once you take the antibiotics, your the gut flora is like the whole lawn is destroyed. All of the grasses have been taken away. It's like a disaster. I remember it very well. It says it's a disaster. It's like your lawn is just gone without taking any actions. And of course, you eat food. You will eat food, and carbohydrates, probiotics will get into body with the food, and so those probiotics will grow, but it's a very unsystematic and disorderly way. So your lawn, after it recovered, it will be full of all kinds of weeds. So you need to intentionally increase the intake of the biodiversity of your own gut flora, so that you will have a beautiful lawn later. So that is a very interesting article. Thank you, Dr. Jing, for such a very vivid description, an analogy that help us to understand this issue. Are there more questions? We have 5 minutes left only. Well, I saw a literature that says that probiotics will help the allergic sinusitis. So I would like to ask Madam Jing, is that right? And would you elaborate on it? Well, what we see is that indeed it will help. And I think it's very clear. It's gut flora. It's like the Great Wall we have in China. You have laid the bricks, and then you have guarded. Then enemy won't be able to get in. And if you have very good internal gut flora, then it's not so easy to have any allergy. So this is one of the theory about the barrier. You build a good barrier. And the other thing is that that the bacteria should not spread too quick, too fast. This is also a way to control allergy. I've seen some studies on this, but more of the studies on eczema. My understanding is that it's probably easier to control the result or to observe for the study on eczema, but not so much for allergic sinuses, sinusitis. That's my understanding. Last question. Well, I think we have run out of time. Okay, thank you all. I would like to thank all of the panelists. Thank you very much.